Let's talk about atrial flutter. In this cartoon of the heart, atrial flutter represents an abnormal misfiring in the top chambers or the atria of the heart. This is generally an organized large circuit where the electricity gets hung up and keeps misfiring. The most common type happens at the junction of the blood vessel entry into the right top chamber or the right atrium. This can be easily treated with a procedure called ablation, where we disconnect one part of the circuit so the electricity can no longer keep misfiring. It's like cutting the spokes of a Ferris wheel. An ablation in this area is over 90% successful and is often the first-line treatment. However, if you're not a candidate or do not want an ablation, we can try medications. Overall, however, they're not as effective. For most cases of atrial flutter, we also suggest that at least for a short period of time, you are on blood thinners to reduce the risk of stroke. In terms of restrictions after ablation, we request that you don't lift anything for 2 weeks to protect your groins and prevent bleeding in the groins. Also remember that atrial flutter can trigger other atrial issues like atrial fibrillation. So sometimes fixing the flutter can possibly prevent development of other atrial arrhythmias. Thank you. This is Dr. Mehta.